So, as I said, we will be today. I'll briefly give you some information in terms of the overview of communicable disease and non-communicable disease. Then we will discuss TB control strategies, blindness, and control measures. I think that I have added some other topics which were not on the timetable, which I shared with you. We'll also discuss a bit of anthrax and other zoonotic diseases, MDR, TB, injuries and disabilities, neglected tropical disease. We'll discuss a bit of cancer. Then the laboratory is very key in terms of control of disease. We'll try to get someone from the laboratory to give us the position of the lab. Then in the HIV issues, we'll discuss the overview of the ART program and the current status of the HIV epidemic. We'll also cover HIV prevention strategies, how we monitor HIV and AIDS programs. In malaria, we'll discuss the control of malaria in Zimbabwe and how far we've progressed in terms of controlling malaria. Then we'll discuss provision of ART service in adolescents. We'll also discuss, adolescents' reproductive health issues, palliative care. Then the multi-sectorial involvement in terms of HIV care. We'll try to get someone from NIC to give this to give us this lecture. Then now there's issue of key populations in terms of HIV provision. We'll try and also give you a lecture trying to discuss some of the issues for key populations. Then we have got palliative care issues. We will try and get someone from Island Hospice, to try to give us a talk on palliative care, because I think it's also important for you to understand that. Then we have got other non-communicable, in the other topics which we'll discuss cardiovascular disease, schistomiasis, emergency preparedness response, then some basic principles of how to control communicable and non-communicable disease in terms of some of the key elements which you need to understand. Then I think these days there's much talk of the 1990 strategies for the HIV program. So I think we also try to look people within some of the partners who are implementing HIV programs to really discuss with us, to discuss with you what are some of the current strategies which they are implementing across the cascade of care in terms of HIV testing, linkage to care, ART initiation, viral load monitoring, so that you meet the 1990 targets. But I think now there's been a shift from the 1990 targets. People are talking about the 95. So you try and get current information from those who are implementing. What are some of the things they're implementing? Then we'll also try to discuss with you issues to do with epidemiology of pandemic, the influenza, some of the emerging diseases. And since currently we are in the corona pandemic, we will also try to discuss with you some of the issues which we need to understand in corona. Then there are issues of malignance and in terms of programmatic issues and policy issues. We also discuss those issues. Then obesity, national blood transfusion, global fund, then community involvement in HIV prevention and control. We also cover that. Then some of these we'll try to get people from the national AIDS, within the MOH, the AIDS and TB, to discuss some of these issues, the global, and also from global funds to discuss some of the issues. Then these days there's issues of EMTCT and validation, where we are now eliminating mother-to-child transmission. We also have a talk on that. Then most of these programs which will be implementing their public health programs, which we'll be discussing. So I think some of you will end up working within this program. So it will be key for you to understand how some of these programs are managed. So we'll also have a lecture where we'll be discussing how to manage these public health programs. Then at the end, we will see, because we need to have some assessment at the end of the module. We'll then discuss how we are going to have that module. So we'll discuss the logistics of how we are going to have that, either we'll have it, maybe something written or online, we'll see. I think this is our first time to organize this, so we'll then see the modalities of how we'll be able to organize this. I see Dr. Shirenda here online. Do you have anything to add as an introduction for this module?
Thank you, Dr. Makurumi. No, I have nothing to add. I think you aptly described the module. It's we usually run it for 1 week, but we have made 3 weeks to cater for the 2 hours that we are able to teach per day because of the technology. It's communicable and non-communicable diseases are a major public health problem. They contribute almost 80% of public health budgets globally. So it's important to understand them. Under the lab component, I think we will need to discuss the current diagnostic methods that are being used during outbreak investigation and all those things, so that you are up to date. But otherwise, you can proceed, Dr. Makurumi.
Okay. So I don't know any clarification in terms of the logistics for this module from the class. If you've got, you can raise your hand if you've got any issues which needs to be clarified. So I think it seems it's okay. I will stop sharing this one. As I said today, I'll just give you some of the statistics which I got from the World Health Organization, which you just need to look at in terms of the burden of communicable disease as an introduction. I will share the PDFs with you so that you can read them. I also got the other one. I have got 2 things which I will share with you, just for you to appreciate the burden of communicable disease. So I will stop sharing this and share another. So I didn't prepare a formal lecture on this, on the introduction, but I think it's more of the numbers. So I hope you know this Institute for Health Metrics and Evaluation, which is part of the University of Washington. I think we have had some of these projections which are being some of the projections for the COVID-19, which are being I think from America. I think this institute is one of the institutes which is leading in terms of giving some of these projections. So they also have country profiles where they try to give the information on various issues, including communicable disease and communicable and non-communicable disease, issues to do with the population, issues to do with GDP. So I thought this should be a good introduction for you in terms of understanding just the overview of burden of communicable disease in Zimbabwe. So within our setting, within the Ministry of Health, I've been trying to look if we have recent information and recent data regarding NCDs it seems our systems are not really up to date in terms of conducting the necessary survey to understand the current burden of communicable disease. I saw one of you posted in the group where they posted I think, some of the survey which was done. I think it was back in 2000, way back, I think before 2000. So one of the study which was done to try to assess, to look into the prevalence of communicable disease within Zimbabwe. I think we also get more. We will try and get people from the ministry, from the NCD unit, who can actually give us more information. But generally, it seems we have got a deposit of data within our setting regarding communicable disease in terms of the burden. Most of the information which we have is either from World Health Organization or it's from other organizations which have the responsibility of really analyzing some of these parametric, like the Institute for Health Metrics and Evaluation. So this is the population according to them. I think it's the same, which is 15 million. Our GDP per capita, which is this one, which is 1.896. Fertility rate, then educational attainment rate. Then in terms of the life expectancy, you see usually, and you see these trends where you used to have a very high, a very high prevalence rate during the 1990-92 era. Then there was a huge drop around 2004 up to 2008. Then can someone maybe give the reason why we had this drop between 98 and 2008? What was the cause of this? And now it is almost peaked. We are almost returning to the 1990 levels. Maybe someone can raise their hand to explain. So I see Nyasha, your hand is up. Nyasha, you can unmute.
I want to say, yes, my hand was up.
So you
I want
can
to say this is yes, my response to this is the HIV pandemic. In the 1990s, there was no treatment for HIV, so the fatality was high and the life expectancy was low. But now we have solutions for HIV, and yet the life expectancy is going up again.
Yes.
They're controlling the disease.
Yeah, so that's very correct. So this huge drop, it was mainly due to the HIV pandemic. But now I think the ART program started around 2004. Then gradually, it was at a few clinics. I see Rutendo, your hand is up. Do you have something to say?
I was going to say the same thing that Dr. Makoa highlighted, that around that period where the life expectancy had decreased or went down, we had a peak in the HIV prevalence and deaths as well.
Oh, okay. So I think that's perfect. So this graph just show, in terms of the mortality, in terms under 5 and under 1 year, and under 1 year, you can look into these things to try to see the trend between 1990 and 2016. You also see, a same peak in mortality rates around the same 2008, 2010, and also starting the same period, which also tends to relate to the same HIV and AIDS pandemic. But one of the graphs which I thought would be interesting for you to understand, it is this one now. If you look into the causes of deaths in Zimbabwe. So if you look this was in 2007, and this was in 2017. So this is the percentage change in terms of the contribution of mortality. So if you will see in terms of our diseases within Zimbabwe, in 2007, you realize that our HIV, our tuberculosis, our lower respiratory tract infections, our neonatal disease, they really contributed. They contributed most of the mortality. And we had our ischemic heart disease, our stroke, our diarrhea or disease, whatever. So if you see these color codes, maybe you see it below. But I think, yes, the burden of the burden of non-communicable disease, these are the blue ones, the stroke, the diabetes, and the ischemic heart disease. You see in 2007, diabetes was at number 11, but if you check now, it has actually gone up to number 9. Then things like ischemic heart disease, they used to be number 4, but now they are also going up, a ladder in terms of contributing to mortality within our setting. And if you also look at this percentage change, since 2007, in general, actually they're trying to show, yes, communicable diseases, they still really contribute, most of the mortality, but we have now a significant number of patients now dying because of some of these non-communicable diseases. So I think this is just the graph, which is showing all these things in terms of range. As I was explaining, to say communicable disease, maternal, neonatal, and nutritional, then non-communicable disease and injury. So we still have this, in terms of premature death, we have, yes, most is due to communicable, but we have our non-communicable disease also still in the lead. So you can also look into this slide also, and what health problems cause the most disability. If you now look in terms of disability, you see in terms of the contribution, you have got your HIV and AIDS at number 1, and both within 2007 and 10 years after. But if you look in terms of disability, you will see most of the disabilities, they are due to what? They are due to, to non-communicable diseases. You've got your headache, your lower back pain, your diabetes, all these things really causing most of the disability. I hope you understand the meaning of the words disability. Can someone, is there someone who can give us the, how do you measure disability, or what is this disability which you are talking about? Or what are some of the parameters which are used to measure disability? Maybe you can raise your hand up. Have you ever heard of the DALYs and the QALYs? Hello, have you ever heard about the DALYs and the QALYs? So I think you have that as a homework. Please go and read about, how do we really measure disability? Read about the QALYs, read about the, I see you can unmute yourself, Linda, and maybe.
Morning, say.
Yes.
So yes, we have heard about the DALYs and the QALYs. DALY is the disability adjusted life years, which is a measurement of the years in that a person spends limited by disability versus the actual time that they die, which is like the life expectancy. And then the QALY is the quality adjusted life years, which is a similar measure to the DALY.
Yeah. So I think that's, I think you summarize it so well. So these things, all these, so remember you've got mortality, and which is like that one is, but we also have the disability which come due to diseases. So I think those are like different, measures of diseases in terms of disease burden. So in terms of disability, you will see most of the disability, happens because of non-communicable disease. If you look, most of the communicable diseases, yes, they can have, long-term complications, but, most of them, they tend to resolve. But for the, your diabetes, you've got damage to your kidney, damage to your eyes, damage to whatever, and then for some of these, so you've got this residual damage, which occur because of non-communicable diseases, as compared to communicable disease. Yes, Ndoa, you can unmute yourself and comment.
Okay, I wanted to ask on disability in terms of ICF.
In terms of what?
ICF.
What do you mean by ICF? Sorry.
International Classification of Function.
Okay.
When you talk of disability, do you talk of the impairments and the activity participation and limitations, or is a different form of disability that you are talking about?
So I think I'm not sure of. It's my first time to hear about this classification which you have mentioned, but I think it's not like really a specific to say. So I hope you not. For me, I think it's an array. You cannot really say it's. But all those things which you say, which you have mentioned, in terms of the limitations, in terms of organ damage, in terms of the movement, all those things. So I think it's more or less the same issues which we have raised. So you cannot really say there are issues which we say these are the specific, but so many things really apply to that definition. But I think if you read through the how we measure the DALYs, how we measure the QALYs, you can then see that actually there are more parameters which are included to really come up with those parameters. So it's not like really a fixed way of measuring, but it really covers more issues.
Okay, thank you.
So I think these are almost the same, and really the same graphs. If you combine what causes most of the deaths and disability combined, you also see we have got most of the things due to communicable diseases, but you also have non-communicable diseases, and you have also injuries coming into play. Yeah. So I think more or less the same graph. Then if you look at the risk factors now for Zimbabwe, in terms of risk, in terms of what are the things now which are driving most of these deaths and disability combined, you have a whole array of things like the unsafer sex, mainly for HIV, your malnutrition, your intimate partner violence, your air pollution, your wash issues to do with water, and sanitation, use of tobacco, alcohol, all these issues, they really come into play. But if you see in 20, I just want to see the change in terms of if you compare 2007 and 2017. So you see our HIV, the unsafer sex, some of it's not only the HIV which is caused by unsafer sex, but we see it has shifted. They've got more of malnutrition. Things like air pollution are becoming top. Things like wash, they're also coming. Then our use of tobacco is also coming up. Then your glucose, your high blood pressure, your body mass index. These are risk factors for non-communicable disease, which means we are seeing an increase. We are seeing an increase, in some of these factors, and they are now really topping up on the list, which are now really causing the non-communicable disease. Then I'm surprised with this one, the intimate partner violence, our gender-based violence. It has kind of really gone down, and it used to top, but now it's a minus in terms of the decrease. But I don't think this is maybe this was 2017. But if you look with the coronavirus, cases of gender-based violence and what they're now really going up because partners, they're spending more time together. So this was also another issue is going up. Then there are a whole lot of other things within these slides which are not relevant. But I think as public health practitioners, you need to understand them in terms of access to healthcare, quality measure, things to do with expenditure, how are people really financing their health, whether it's prepaid, private insurance, you've got out-of-pocket, government health spending, and development development partners. I think you can really read this if you are interested. I hope you have you done the module in health financing? Maybe I'm not sure, but if you've done it, you'll discuss these things in detail. So the last tables actually, they're just comparing, you know, Zimbabwe with other countries in terms of the various things, which I think you can go through. You can go through this and understand. I'll share this within your group. Then I will also try to share another one. This one is from what I was sharing was from the Institute of what. Then I'll also share the other one from World Health Organization. So it's the same issues. I'll share again those for you you need to compare those two. So this one is from the World Health Organization. I got it from the World Health Organization. It's less detailed as compared to the one which I was sharing from the National Institutes from the University of Washington. So I think it's the same thing, you know, which is really, you know, showing the same parameters in terms of this one just focuses on NCDs. You know, where it is showing, you know, 11% of our NCDs are due to cardiovascular disease. We have got cancers, we've got chronic respiratory disease, we have got diabetes, we have got other NCDs. But if you look, the contribution, I think it was similar from what we were discussing prior to say, yes, we have got an increase of non-communicable disease, but most of our burden within our setting is due to communicable maternal and perinatal conditions. They still really constitute half, you know, most of this. But if you injuries, they have also their contribution. But if you look at the NCDs, you will see cardiovascular diseases now. They constitute the bigger chunk, 11%. So this is your hypertension, your coronary heart disease, your myocardial infection, and some of those diseases which affect the cardiovascular system. So you also have your mortality, which you can read. You also have your risk factors, which you can also read through in terms of males, female, and total. I think they are the same thing. You can combine what we are discussing from there and this. Then this one's also showing the trends in terms of tobacco use, in terms of obesity, in terms of raised blood pressure, where they are comparing, you know, the past trends, the projected, and as compared to what is happening. So if you see, the dot is the global trend for tobacco use, and for the dot is whether it's red or blue is the global trend. But if you see ours, you know, our projected trend, either for smoking, for obesity, for blood pressure, we are above. We are what? We are above the global projections, which means actually we're at risk actually of developing some of these conditions. Then we've got the national response system. What are we doing as a country to try to really address some of these cardiovascular, some of these NCDs? I think our systems for communicable diseases, they are well structured. So if you look, the HIV program, you know, it's a well-structured program, you know, from national level to province, to districts, to clinic. You've got so many partners really funding. The same applies to malaria, the same applies for tuberculosis, the same applies for some of these things. But if you go to the NCD, you know, to the NCD side, I think we're still lacking. But now I'm happy if you go at national level, We have got, you know, we now have a unit for NCDs. We have got some deputy director within the NCDs. We think actually we are really trying to really put some of those systems in place, but we'll hear from them. We'll try and invite them so that they discuss some of these issues with you. But generally, we have gaps in terms of our national response. But I think I realize now if you go to National AIDS Council, they are now really, on top of funding HIV activities, they are also really trying to start to, I think they now have a component where they fund cancer, you know, because I think there's been much talk about cancer. So they are also supporting cancer activities, which I think is a noble idea. On top of, because most of the cancers within our setting, they are caused by HIV. So I think that's a positive development. So I think from my end, as an introduction to this whole topic, that's what I have. I will take your questions or any additions before we call it a day, so that then we can meet tomorrow to discuss other issues. Do we have any questions or areas which needs clarification? Yes, you can unmute yourself, Chikanda.
Oh, yes. Thank you so much, Doc. Just out of curiosity, the way these diseases are classified, I see malnutrition is usually clustered, like it's put in the red, which is the communicable diseases. Is that where it really should be? I'm not sure.
That's a good question, eh? I'm not very sure. Maybe Dr. Shirenda can assist, but I'm not very, why is it? I also noticed that to say malnutrition is usually put under communicable, but I don't think it's a communicable disease. It should follow under non-communicable disease. I'm not sure why that discrepancy. Dr. Shirenda, I see your hand is up. Maybe you can comment on that question.
Okay, so thank you, Dr. Makurumidze, for that excellent presentation. Malnutrition is not a disease; it's a syndrome, and it includes both undernutrition and overnutrition. So obesity is part of malnutrition, for example. And severe underweight or kwashiorkor is part of malnutrition. The major causes of undernutrition are usually due to communicable diseases, as opposed to overnutrition, which is primarily a non-communicable disease. However, the magnitude of malnutrition in terms of the causative organism or causes is largely, so I have to take this call. You can continue.
Okay. So yeah, I think he tried to explain it, to say, you know, malnutrition is not like it's more like a syndrome where, you know, we have got the underlying, you know, cause of nutrition. There are several really things which might be contributing to that. Maybe that's why you can have, you know, this issue, this challenge in terms of the classification. But I agree with you. It's something which might need, maybe we need also to follow up on it to really see why do they tend to put it under. But from our lectures, we discussed malnutrition under NCDs.
Oh, thank you so much, Doc.
Yeah. Then any other question? So, as Dr. Chirenda, you can, you see your hand is up. Dr. Chirenda, you can unmute your, okay, you're still on. I think if you don't have any questions, and Dr. Chirenda, I think he wanted to add something, but he seems now to be on a call and busy. He can always update us, whatever you wanted to when we meet next time. So if there are no any questions, let's call it a day. Then we meet tomorrow. In terms of the lecture for tomorrow, I will let you know the topic. Enjoy the rest of your day. I will share these materials. I will also try and share this recording. But remember, I hope you have access to to data, because I think it will be a heavy recording. I'll try and create a link for it, which you can use a link, or you can download the full. I'll share an audio and the video. So you choose which of the two you want to listen to. Nyasha, do you have
Okay, thank you, Doc. Yeah, I would also ask something. As FETP residents, tomorrow we have presentations. What are we going to do about that?
Tomorrow,
presentations. Those Friday, yes, those Friday meetings. They are going to be happening tomorrow. Where we have those who have done their topics are going to present their topics tomorrow.
Oh, I was not aware of that development. Which means tomorrow. When are you presenting tomorrow? What time?
They say the timetable is from 9 to 3.
So that's fine.
9 to 2.
No, that's okay. Which means tomorrow we will not have tomorrow we will cancel. We will not have a lesson. We will skip tomorrow, and we will have it on Wednesday. So tomorrow you attend to your presentations.
Can I have you yet concluded, right?
No, you can add whatever you wanted to add. It's okay too.
Yeah. Okay. So that's what I think on nutrition. That's the main reason, because it's a syndrome, and sometimes the major causes are communicable. But I wanted to check from the students whether they've gone through, when you were doing your epidemiology and outbreak investigation module, did you go through the basic concepts on communicable diseases like transmissibility, infectiousness, etc., etc.?
Yes, we did. We touched a bit on that, but maybe if you just refresh for us.
No, we don't want to repeat. I mean, if you can refresh using your notes. Because I think, like what Dr. Makurumidze said, there are a number of topics that we have brought in which we never used to teach. So we may not have time to go to revise. So just know that in your exam, we will include those issues that you learned during the outbreak investigation, because it's important for this module.
Okay, thank you, sir. Then from the questions, I see someone was asking, what is the difference between NCDs and what is the difference between non-communicable disease and communicable disease?
So okay, so that's a definition issue. What I will do, I will still send you a few slides that talk through that. But the main difference between the two is that communicable diseases are usually transmissible from person to person, whereas non-communicable diseases are not transmissible from person to person. You were asking about malnutrition. We have cervical cancer. Cervical cancer is considered a non-communicable disease, but the causative organism is transmitted from person to person. So that question may also come, and usually in an MCQ, the following are examples of non-communicable diseases, and cervical cancer may be put in there. So the main reason, just the way the disease evolves, the transmission patterns. So that's the main difference.
Okay. Yeah, I think that's, yeah. You know, you cannot get a non-communicable disease from someone, but a communicable, you can get it from someone in a similar, yeah. That's what Dr. Shenda was trying to say. Do we still have any other questions before we call it a day? So thank you so much for attending this first lecture. I think it's because my worry was the attendance, but I'm happy with the attendance. We have 29 participants, which is good. I'm not sure, is it possible for the class rep to see who has attended and who has not attended, so that we follow up to see what are the challenges that they are facing, and we try to assist them. So which means 29, that's a good 20. If I remove myself and Dr. Chirenda, it means 27 attended, and another 7 did not attend. So I think we need to see who didn't attend and what are the challenges they are facing. If we can assist, we'll try and assist.